welcome to today's COVID-19 update. We are speaking with the Honorable Minister of Health, Dr. Frank Anthony, who has graciously allowed us this interview. Dr. Anthony, thank you so much. Can I ask you, what is our recovery rate like? And I believe it's necessary for us to know that persons are recovering from COVID-19.
Well, with deaths, we have about 80 persons who have died so far in this pandemic in Guyana. It's unfortunate that we are having deaths, but like with any disease, um, you would find that persons who are severely ill, this is one of the outcomes they can die. Unfortunately, with COVID-19, we have seen these deaths, and we have seen the deaths occurring with persons who are older. Um, Most of our deaths have occurred in persons who are 60 years and older. And we have seen that a lot of the persons who have died also had underlying illnesses. So many of these persons had underlying conditions such as diabetes, hypertension, cardiovascular diseases. A few persons had cancers. So these non-communicable diseases are contributed, so to speak. They, they become like a risk factor for COVID-19 patients experiencing the disease in a more severe form, and in some cases resulting in deaths. Apart from the chronic non-communicable diseases, we have seen a number of persons who have died who had other conditions, and these are infectious disease conditions. So we have had cases where persons who had severe malaria and COVID-19. So these two diseases have contributed to the death. We've had cases where people had HIV. So HIV and COVID-19 has contributed to that person dying. We have had cases of persons who had TB. So TB plus COVID-19 has contributed to that death. So many of the deaths that we've had so far were persons who had underlying conditions. And one of the things that we have been repeating over and over again is that persons who know that they have a chronic non-communicable diseases, for example, diabetes or hypertension or cardiovascular diseases, they have to be extra cautious because they are at risk. Because if they get COVID-19, the chances are that some of them might get the disease in a more severe form, and which would require hospitalization. And in some cases, those who have been hospitalized would require ICU care. So it is extremely important that these persons protect themselves, take the extra precautions to ensure that they're not at risk.
Yeah.
The other category of persons, of course, are older persons. Now, in some cases, older persons have a lot of the chronic non-communicable diseases because as you get older, in some cases, we see a higher prevalence of these diseases. So in those cases, you have maybe an additional risk because you're older, you have an underlying illness. In some cases, it's not just one disease somebody might have, they might have 2 or 3 illnesses, and therefore this put them at extreme risk. And to compound those problems is that a lot of people who might be um, having one of these underlying illnesses or 2 of these underlying illnesses, in some cases, these underlying illnesses have not been controlled. So we have seen cases where diabetics who are not controlling their glucose would have come into the hospital. In one case, we know of somebody who came into the hospital who was in a diabetic coma, and because of that, when they came in, they were already in a critical condition, And when tests were done, they were also COVID negative. So these things uh, are the contributing factors. And I think once people understand the risk that they have in terms of underlying illnesses, age, they really need to take precautions. We probably have more than, I would say, more than 100,000 persons based on disease patterns in Guyana who would have those risks, right? And if you take our older population, those who were above 60, that's another category of persons. And people ought to take these precautions,
Okay.
right, to protect themselves. And I think once we are able to see that, once people take those extra precautions, then they would be protected, and we'll probably have less hospitalization and less deaths occurring, because once they're protected, the most vulnerable would not get the disease. But
Oh.
this require effort. This require people taking responsibility,
Of
right?
course.
And we are hopeful that through the education work that we've been doing, that we would be able to get people to understand the risk that they currently have.
All right, Minister, before we touch on recovery specifically, I just you mentioned non communicable diseases. I just want you to reemphasize, or just directly, most people think that the hospital has been shut down and, no other service is happening, but that is not the case.
The hospitals, especially the Georgetown Public Hospital, we have seen an influx of patients with COVID-19. And so they have streamlined the hospital in such a way that allows patients who are having signs and symptoms of COVID-19 to be triaged in a different way. And if they're positive, then they go into some special wards. In addition to, you can come to the Georgetown Hospital, you are triaged in that way if you're diagnosed positive. In some cases, you would be kept at the Georgetown Hospital, and in other cases, they'll transfer you to Ocean View, where you would be kept. So that's with the COVID-19 patient. We have also added an extra precaution, because there are people who present with other diseases at the hospital, and out of an abundance of caution, one of the things that the hospital is doing now is to swab those persons to check for COVID-19, because we have had cases where people came in for other illnesses, and later on we found out that they were also COVID-19. So basically, if you are going to be hospitalized, checks are done to also ensure that to see whether or not you're COVID-19, to check your COVID-19 status. If you're negative, then they'll put you in the regular wards, so you can get attention, in those wards. If you're positive, you'll still receive attention for your whatever other underlying illness you have, but you will go in a separate section of the hospital so as to prevent, infection within the hospital and so forth. Because of what has been happening, say at Georgetown Hospital, we have reduced the number of planned surgeries that you can have at the hospital, and this has occurred from since March. We are right now engaging the surgeons and other technical people at the hospital to see how we can restart some of these services, because people continue to have challenges, and so we need to find ways and means of how to respond to them. In terms of emergency surgeries, however, if somebody come in with an emergency, then you have to do the surgeries, and that has been happening at the hospital. So while some services would have been reduced, it's not all the services that have been reduced, and outpatient clinics and other things are still going on, lab services and so still happening. And we are making efforts to try to bring back some of the other services that would have been reduced. And this is Georgetown Hospital, and similar things are happening across in the other regional hospitals.
Yes.
Health centers have been a challenge because a number of the doctors and nurses who were working at these health centers, um, in some cases it was reported that they literally closed the service. We have since been examining that and to ensure that services are provided to people who need those services. And a good example, we just spoke about chronic non-communicable diseases. If since March people were not able to access their clinics, then a lot of people with, say, diabetes would not have had medication, therefore their conditions might have deteriorated because they're not getting their medicines and so forth. So by reopening these services, ensuring that people can have access to clinics and so forth, of course using the COVID-19 guidelines and the rules that we have in place, that they are able to access service in a safe manner, and that when they come they can also get the medications and things that they need. We might have a little transition period because, as you know, we inherited a situation where a lot of the medicines, if they weren't expired, they were short and out of stock. And we have taken we have started to buy emergency supplies of drugs to ensure that we can put those medicines at the health centers and where people need them. So it's an ongoing work. We haven't been able to completely restock as yet, but it's something that has been in progress right now.
Okay, great. I note with the health centers, of course, they do different things on different days, so persons can contact them and see when they can go specifically.
Yeah, they have a routine. So on some days they do maternal and child health. On other days they do immunization.
Yeah.
Other days they would do maybe general clinics and so forth. So they have a routine, and the community that these health centers are serving would know the days when they can go.
Yes.
But what we want to ensure is that when people come, they're in a safe environment, they observe the rules so that we can minimize any chances of transmission at any one of our health facilities.
All right, Minister, thank you so much. Let's touch on recovery, because a lot of persons know that persons are recovering from COVID-19, but they're not really aware of the figures that much. So could you update us?
Well, we have had a good success rate in terms of people recovering. And as it is right now, about 80% of the patients who were infected with COVID-19 have recovered. And I think that's a good thing, that we're seeing such a good rate of recovery. Currently, we have about 772 active cases, and they are all under observations. So you have a percentage of those, a small percentage, who are in the hospital. You have another percent that is in the institutional isolation, and you have the majority of cases are in home isolation, and they are being monitored by a team that we have in every region, who would call them on a regular basis to ensure that the signs and symptoms, if they're experiencing any signs or symptoms, that they can communicate that with our medical team. The persons in isolation as well, if they require urgent assistance, they can call one of our hotline numbers, and we would have a team that respond to them. We have repurposed our EMS service. So the EMS service would be able to respond to people who have a general illness, but also we have a specialized unit that would respond to persons who might have who probably have all the signs and symptoms of COVID-19. So they will take extra precaution. They would come with their PPEs and so forth, so that they can transport that patient in a safe environment, and to avoid any contamination. So that service, we have started that as of this week, and and that would be there until we are able to rid ourselves of this pandemic.
Of course. Minister, you have a unit that conducts spraying and so on. How is that service accessed and who can access it?
Well, we have, as part of our health response, we have what is called the HEOC, the Health Emergency Operations Center, and they have several functions. One of the functions is to deal with environmental health. So the environment in which people are working can be contaminated if somebody with COVID-19 came there, sneezed, and droplets fall on the ground and so forth. So to help to sanitize the environment, we use special chemicals to be able to do that. And so this unit can come into workspaces and to perform those functions. They've been specially trained and they perform these functions, and they've been helping a number of entities to sanitize their workplaces or any place that people feel threatened.
Right.
Right? So, for example, when we had the cases at the prison, we assisted the prison by sending in this unit to help the prison to sanitize the area, so that if there are droplets that are lurking around, by using these chemicals, that we would have killed whatever viruses might be lurking around.
And as the countries in the world, some of them have greater figure than Ghana in terms of deaths and infection. Persons believe that our numbers are rising. Is it necessary? And I'm asking you, based on everything your ministry is doing, to have a lockdown.
Well, again, we have to examine cases and where we are getting these cases. And as far as we are aware, so for example, the numbers in Region 4, we had over the last week about we had about 207 cases that occurred in the prison. So we know it's a specific area. But that 207 number would inflate the number generally in Region 4. So when people see the Region 4 number, they might be alarmed. But when you disaggregate it and see exactly where it is, then we are able to put control measures in place to contain the epidemic in that institution, which we have already done, as in the case of the Lusiktan prison.
Yes.
So we have to, by looking at the numbers, disaggregating it, we have to respond appropriately. At this point in time, one of the big choices that we have is to have a balance between life and livelihoods.
Yeah.
We don't want to lose life, but at the same time, we do not want to destroy livelihoods. And this has been the challenge around the world. It is a challenge here as well. How do we bring that balance? And we will continue to work on that, because we want people to be able to go to work, but go to work in a safe environment so that they can earn a living as well. If you shut down everything, not everybody is at the same economic status. Some people can afford a shutdown, but there are many, many Guyanese who are really vulnerable. And if you shut down the country, then many of them would not have the means of taking care of themselves. So these are the kinds of challenges that one would have to take into consideration when making a decision such as having a lockdown. At this point in time, one is not contemplated, because we have teams that are responding appropriately, and if persons in the society take the requisite actions at preventing the disease, then I think we can contain the spread. But we are going to have cases, there's no doubt about that. You're going to have cases, and we are working to reduce transmission, and once we can get transmission reduced, then we are going to make that difference.
All right, Minister Anthony, I want to thank you for speaking with us. And I know you've specifically been advocating for persons to continue wearing their mask, wash their hands, and so on. Are there any last comments that you'd like to make before we wrap up?
Well, I think over the last week I've been talking about the three W's, and that is to wear a mask, wash your hands, and to watch your distance. And maybe that's a simple way of people remembering the key things that you need to do in terms of prevention. So
Thanks.
once you wear your mask, at least you prevent transmission. You watch your distance, you stay that 6 feet apart. Um, then if even perchance if there's somebody sneezing, those droplets wouldn't come to you. And even if you get your hands contaminated by touching surfaces, by constantly sanitizing your hands, you're preventing that type of spread as well.
All right, thank you, sir. We've been speaking to the Honorable Minister of Health, Dr. Frank Anthony, who has given us an update on COVID-19 in Ghana. Remember, for more information, you can check out our website, dpi.gov.gy, and our social media platforms as well, Instagram and Facebook, and the Ministry of Health's website as well for further information.